Yeah, so preventing lung cancer, biggest risk factor is smoking cigarettes. So if you smoke, stop smoking. And if you never smoked, don't start. That's really short, straightforward. I'm Dr. Krystle Pew. I'm an interventional pulmonologist, and I diagnose and stage lung cancer here at UAB. So lung cancer is where you have normal cells in the lungs that become abnormal and start growing unchecked. So basically a normal cell starts to replicate and divide numerous times and usually shows up as a pulmonary nodule or a spot in the lung. So lung cancer is kind of sneaky. It doesn't show up with blood, it doesn't show up with pain until it's really large. So you can have a nodule that's getting bigger, but some of the more subtle signs, cough, shortness of breath, difficulty breathing when you're walking can be some subtle signs that there could be something going on in the lungs. But your lungs aren't really innervated, they don't have lots of nerves. So as the nodule or the tumor grows, it doesn't really cause problems until it's touching like your airway, that makes you cough. A rib or the lining of your lung, that's where you might feel some pain or discomfort, which is why screening is so important, because it's more of a in the background type of process than one that really shows up early on. So there's some very specific guidelines on who gets screened for lung cancer. It's not like other cancers where if you are an adult and you have a colon, you get colon cancer screening. We look for patients that are age 50 to 80 that have at least what we call a 20-pack year of smoking cigarettes. So you may have been a pack-a-day smoker for 20 years, or maybe you were a 2-pack-a-day smoker for 10 years. And if you did stop smoking, did you stop smoking within the past 15 years? Or you're an active smoker. So there's a lot of guidelines on who gets screened for lung cancer, but if you smoke or used to smoke, then that's a conversation you should have with your primary care. So the biggest thing always will be to never start smoking cigarettes, and if you are smoking cigarettes, to stop smoking cigarettes. That's really short, straightforward when it comes to preventing lung cancer. I think lung cancer is the deadliest cancer, not because we don't have great treatment options, but because we aren't screening enough. We're not looking for it so that we can find it early and treat it early. Yeah. So smokers over 50, or used to be a smoker over 50, start the conversation with your doctor. Ask them, do I need to be screened for lung cancer? And then we'll go through, take a really detailed history, see what you smoked, how long you smoked, when did you stop smoking, are you actively smoking? And that's a way for us to piece out whether or not you're a candidate for lung cancer screening. A screening is a CAT scan. It is a picture of your lungs, a little more detailed than like a chest x-ray that we're all familiar with. And that lets us see the airways, the lung tissue a little bit better, and that's one time a year. So it takes about 5 minutes to have a CAT scan done. The difference between a CAT scan, like a chest x-ray, and a CAT scan is kind of like what instrument you use to cut into a steak. A butter knife is trying to get through it, really difficult. I can see the big structures, but the fine details of your lung, I can't really see it that well with the chest x-ray. A CAT scan is taking a nice steak knife and slicing through really nice and even. So we get really thin, detailed slices of the lung. So if you have a small spot, we can capture that. And being able to see that and differentiate between that is what we need a CAT scan for. So more detailed. So if you're diagnosed with lung cancer, there's a big list of options and treatment that's really driven by the stage. Surgery with curative intent, so we go in and we remove the tumor from the lung, and you're done. You just go back to screening or surveillance imaging. Radiation, where radiation beam is targeted and it kills those tumor cells. There can be chemotherapy, where we give you medicines to help kill off those abnormal cells. There can be a combination of chemo and radiation. There's immunotherapy or targeted treatments where we look at the mutations or the abnormal cells and what's driving them to grow abnormally, and then we target that. And so those are all of the different kind of combinations that we can use to treat lung cancer. I would say if you are a smoker, talk to your doctor about getting screened. We are not doing a great job as a country when it comes to lung cancer screening. About 5% of people that are eligible for lung cancer screening get screened, and you want to be in that number if you smoke or you used to smoke.